As far as age restrictions on orthodontics, I mean, so the AAO, the American Association of Orthodontics, does recommend 7 years old for your first evaluation, an orthodontic evaluation, whether that is through your pediatric dentist or through us. But the truth is there's not really an age restriction. We've got 70-year-old patients, we've got 6-year-old patients. Now, we don't have any 3-year-old patients, but the idea is that when we're young, and there's something called phase 1 treatment, and some people will come in and say, I've never heard of that, I don't believe in that. But we can show case after case where you can make a major impact on a child's future development through utilizing treatment at a younger age, which would typically be 6, 7, and 8 years old. Our typical orthodontic age is around 12, that's kind of the standard age. 11 to 13 is the kind of adolescent orthodontic age. But sometimes you do need to intervene to correct certain types of bites before then. And it can be a very important part of their overall care long term. And then as far as adults go, we can actually significantly improve their long-term dental health. So, you'll hear parents say, yeah, I'm too old for that. I've already done that. But really, adult treatment is becoming a much greater percentage of orthodontic treatment in general. There really isn't an age restriction. And I actually just did a lecture or presentation to a group, and that was really what the basis of the lecture is, to kind of avoid misconceptions. And that doesn't mean that every patient that's 12 walks in and needs braces. That doesn't mean that every 7-year-old needs braces, or that doesn't mean that every 60-year-old needs braces. But there really isn't an age restriction. You've got to take the individual, their health, their history, and things like that into play, or into account, and go from there. But really, there isn't an age restriction.